Thank you. I will try to talk loud enough so that most of you can hear. I have been accused of talking too soft on numerous occasions. I am a family practice doctor. I'm not a neurologist. And my interest in Parkinson's was piqued a few years ago. Well, let me tell you a little bit about myself before I launch into my little spiel. I am fairly new to the area, having moved back to Easley about a year ago. I'm not a native of South Carolina, and I'm not new to South Carolina or Easley either. Our family moved to Easley about 20 years ago, and I did my residency training over at Greenville, and then I was in practice in Seneca for about 8 years, and then we left the area, and then we left the country.
Not Africa, right?
No, I've been to Africa. I've been to a lot of places on short-term trips, but our family served 5 years in East Asia, and then the last 3 years we were in Thailand. So that was the last place I was serving. And those last 3 years, my primary job was to help to care for other missionaries. I didn't directly take care of them. It was more of they would write or call, they'd send me an email, or they'd call and they'd say, I've got these symptoms. And I would, kind of run it through my head, do a quick, you could have this, you could have that. And then I would have to decide, do I let them try to take care of this in country where they live, which some of the places in Asia have great medical care, as good, or I think in some ways maybe a little better than what we have here, because they don't have some of the red tape we have here. But some places in Asia don't have very good care. And so it was not just my job, it was the job of the team that I helped to run. It was our job to try to figure out where Mr. Smith needed to go to have whatever taken care of. And on one occasion, this was several years ago, a young man he was starting to develop some symptoms that was concerning. He had been on the field for a couple of years, had been put on some medicine for depression. And after he'd been on this medicine for a while, he started to have some pill rolling, and he started to be a little stiff as he walked. And the concern was that he might have Parkinson's. And Parkinson's is a disease that up until about 15, 20 years ago, we thought it was something that seniors got. Somebody over 60 or 70. And then Michael J. Fox got Parkinson's, and the age, we kind of cranked it down. It's like, okay, sometimes 40-year-olds will get this, or younger. I think he was actually in his 30s when he was diagnosed. And then a few years ago, another famous person, Muhammad Ali, developed Parkinson's, but I think they're attributing at least part of his to the poundings he took all those years in the ring. He was a phenomenal boxer, but those guys take a beating over time. And, those are just two examples. There may be some folks in the room that have Parkinson's. I don't know. I would imagine there's folks in the room who know people who have Parkinson's. I have a few patients, and most of them are followed by Dr. Baxley or Dr. Sherrill for their Parkinson's. And that's who I'm going to send you to if you came to my office and you had symptoms that were suspicious. Parkinson's often presents with this motion. We call it pill rolling. It's just kind of a movement that it's one of the first signs that a person could have Parkinson's. They also often have a tremor, and if you watch me, I've got a little tremor, but it's not Parkinson's, it's just a tremor. And other things that they develop, they will get stiff. One of the things the neurologist would do to evaluate, he would take their arm and it actually kind of ratchets down. Instead of being a smooth movement, it's either real stiff or it's kind of like a machine. Over time, they'll tend to stoop because it has an effect on the the muscles. They stiffen up, they stoop. They start walking like this because they can't walk normal. Their steps get real short, and it's just part of the process, the disease process. I know I was in Ingalls the other day. I was actually walking into Ingalls the other day, and this gentleman walked out, and he was shuffling along, and I'm like, he probably has Parkinson's. So back to my story. The young man, we sent him to Thailand because the care there it's good. He actually had the opportunity to talk to an American neurologist he just happened to be in the country. We considered it a God thing that this American neurologist was available at least for a consultation. He got to talk to him, he got to evaluate him. He couldn't run any tests, but he recommended, okay, you need to see a local. And so we sent him to one of the bigger hospitals there in Bangkok, and he got evaluated. Since then, they've developed a test that can better pinpoint if somebody has Parkinson's. For the longest time, we didn't have any definite tests. We couldn't do a blood test and say, oh, you've got this or that. So many things we've got very specific tests for, whether it's a blood test or an X-ray or a CAT scan. Parkinson's is one of those, you look at the patient, the symptoms, the story, and for a very long time we had no good test. Now we've got a test that is actually pretty helpful. But that test wasn't available, and this man was started on some medicine for Parkinson's. He was continued on that medicine for a couple of years. Well, over the course of time, he was seeing his neurologist on a regular basis. The symptoms that he initially had, the pill rolling and the stiff movements, stiff gait, they went away. Now, we later found out that he developed the symptoms they were side effects of a medicine he was taking for something else. That medicine was discontinued, the side effects went away. Well, we didn't know that at the time. It was one of those, okay, he got better, he's on the medicine, so you think, oh, okay, he's better because he's taking his medicine. Same thing could happen here. I'm not faulting the Thai doctors, because the same thing could happen here. You come to the office, we put you on something for whatever. We put you on a cholesterol medicine. Well, you change your diet, your cholesterol gets better. Maybe you don't need the medicine anymore. Well, I heard from this gentleman later that they were home for a period of time. They were in the States for several months. He went to see his family doctor. He told him about the Parkinson's, and she said, well, let me get you in with a neurologist. Well, he went and saw the neurologist, and he evaluated him. and said, well, let's do this other test. Well, he did a test, very specific test. It was, I'm not even sure the name of it or how long it's been around. But it's a nuclear medicine study that actually can look at the place in the brain where Parkinson's originates. And lo and behold, he didn't have it. He did have a tremor, but he didn't have Parkinson's. So he stopped the medicine and his symptoms were still gone. Those symptoms that he had that were a side effect of that medication, well, they'd been gone for a while, and the whole time it had been attributed to the medicine he was taking to treat Parkinson's. So doctors don't know everything. And y'all know that better than I do. Yeah, y'all know that better than I do. Why Parkinson's? What happens? There's a small place it's kind of in the center of the brain. It's kind of right near the brainstem. I didn't bring any pictures because I'd rather talk to you than to try to fight with images and PowerPoints. But it's a small place, kind of in the center of the brain, kind of in the lower part, almost sits underneath the brain. And in that part of the brain, it makes a chemical called dopamine. Dopamine, we have learned over the years, controls a great many things in the body, affects a great many things. The lack of the dopamine is what causes all these little symptoms that we see, the stiffness and the pill rolling, and causes the short steps, and causes a whole host of other symptoms that if the person goes untreated, you will see these gradually develop. The way we treat it is to replace the dopamine with medicine. And the medicine we give them is actually, it's dopamine, a form of it. And most people, it kind of keeps them at a stable level. It doesn't fix the problem. It doesn't get rid of it, because the place in the brain that makes the dopamine, those cells are gradually dying. We don't know why. Some have thought, well, it could be exposure to chemicals in the environment, pesticides, or what have you. They're looking at a lot of different things. But as yet, still no definite, well, why does this happen? We don't know. As those cells die and this chemical isn't produced, then you get more and more symptoms. Now, over time, if a patient takes the medicine, after a while it loses its effectiveness, and they can try other things. I wish I could tell you we had a cure coming, and maybe we will one day, but for now, it's one of those diseases that the study is ongoing. They're still looking for, the cause, but more important, they're looking for a cure. I know a lot of research is going into it. It's been in the news some over the years just because Michael J. Fox kind of keeps it out there. And if I were him, I probably would too. I had his kind of money and influence, but so it's a disease that it doesn't happen very often, but when it does, there's no, it doesn't, I can't give you medicine to make it go away. We always, we kind of joke in family practice that, we feel bad for the neurologist because all of their patients have things that we can't do anything about. We can't undo a stroke. We can't undo Parkinson's. We can't undo a lot of things, you know, when brain stuff. I can treat your blood pressure and make it better. I can treat your cholesterol and make it better. But a lot of the things they treat they're difficult. And I really appreciate the neurologists for their concern and their continued care for difficult cases. Now, what questions would you have for me?